Since 1954, manual bag valve ventilation has been the standard method of ventilating patients in respiratory or cardiac arrest. Yet there is little positive evidence to show that these products provide good ventilation in the majority of users' hands. Inadvertent hyperventilation, however, is now a clinically recognized and statistically significant consequence of standard bag valve ventilation. It can happen with any healthcare provider, regardless of their skill level, and can significantly affect patient survival. Inadvertent hyperventilation is a significant contributing factor to gastric insufflation due to the high flow rates generated when squeezing too hard and too fast, which can result in aspiration of stomach contents. Barotrauma created by these excessive flow rates causing high airway pressures or stacked breaths as an insufficient expiratory time is allowed before delivering the next breath and the lungs are overinflated. High ventilation rates and volumes and stacked breaths all reduce the space available for the heart to expand and refill on release of the chest compression, which reduces the volume of blood available to be expelled from the heart, reducing the coronary perfusion pressure. Hyperventilation reduces CO2 levels in the blood, causing cerebral vasoconstriction and a subsequent decrease in oxygen to the brain, increasing brain death. During cardiac arrest, laboratory studies in animals have shown a significant link between reduced survival and inadvertent hyperventilation. A standard bag valve device provides no control over the breathing parameters. In the mask-ventilated patient, the high peak airway pressures generated can easily exceed the lower esophageal sphincter opening pressure, creating massive gastric insufflation. The SmartBag MO has been designed to provide guidelines-compliant ventilations by controlling the flow of air from the bag. By responding to the rescuer's squeeze and release of the SmartBag MO, the smart valve in the neck of the balloon limits the excessive flow of gas into the patient's airway. This significantly lowers the peak airway pressure generated and increases the inspiratory time, reducing the risk of inadvertent hyperventilation and its associated problems for the patient and the rescuer. The first rule of smart bagging is, if it's hard to squeeze and the smart valve moves, you're squeezing too hard. The breath should be delivered over 1 to 2 seconds with a slow, controlled squeeze. In a normally compliant and resistant airway, the airway pressure generated by the SmartBag MO is limited to well below the lower esophageal sphincter opening pressure of 19 centimeters of water. The response of the SmartBag MO is proportional to the rescuer's squeeze. The harder the squeeze, the greater the restriction to flow and the stiffer the bag becomes to squeeze. This alerts the rescuer to ease up on the squeeze, resulting in the airway pressure being kept to the minimum required to achieve adequate ventilation. The calibrated pressure actuation indicator in the neck of the bag provides a visual and audible warning as well as the tactile indication of improper technique. Be aware that, even with the hardest two-handed squeeze, at no time is the gas flow to the patient cut off by the SmartBag MO. This ensures that the patient is always ventilated correctly, regardless of the rescuer's inadvertent attempt to squeeze too hard and too fast. The second rule of smart bagging is, if it's hard to squeeze and the smart valve does not move, there is a problem with the patient's airway. If the patient's airway is less compliant or more restrictive, as in patients with COPD or asthma, or those who have drowned or have sustained a pneumo or hemothorax, higher airway pressures will be required to provide adequate ventilation. When greater pressure is required to overcome a highly resistive or poorly compliant airway, the SmartBag MO will allow the rescuer to apply higher pressures. The smart valve recognizes the airway compromise and will not activate until the problem is overcome. By self-adjusting to both the patient and the rescuer, the SmartBag MO optimizes the ventilations, controlling the inspiratory time, and keeping the airway pressure to the minimum required for adequate ventilation to occur. This results in a significantly reduced risk of inadvertent hyperventilation and significantly increases the patient's chance of survival. For intubated patients, the resuscitation guidelines require a change in the ventilation and compression rate to continuous compressions at a rate of 100 per minute and asynchronous ventilations at a rate of 10 per minute. To provide an adequate ventilation volume in the very short time available between compressions, a high flow rate is needed. The manual override, disable, has been provided to block the motion of the smart valve to allow high flows to be generated. It is recommended that the switch only be used during intubated CPR or when confronting uncommon patient conditions that require a high flow rate. Using the SmartBag MO is easy. Every squeeze of the bag reminds the rescuer to provide long, slow ventilations as recommended in the resuscitation guidelines. Just let this SmartBag MO compress under your gentle, slow squeeze. This will provide you and your patient with controlled flow rates, controlled ventilations, reduced airway pressure, reduced risk of gastric insufflation, improved coronary perfusion pressures, reduced risk of brain ischemia. Now that's smart.